Technical Veterinary Learning TVL channel, founded and produced by Prof.A.M.El-Sherif, Mumdouh, Professor of Epidemiology and Infectious Diseases, ex-Head of Department of Veterinary Medicine, ex-Vice Dean of Faculty of Veterinary Medicine, Pennsylvania University. Acute and differentiated infectious diseases of bovine respiratory disease complex, or AU-BRDC. A major problem that large animal clinicians commonly encounter is a group of cattle that are affected with an acute respiratory disease of uncertain diagnosis. The primary goal of clinician must be to take the most accurate clinical diagnosis as rapidly as possible, based on the clinical and epidemiological findings that are identifiable on the first visit. The second goal of these clinicians are giving a prognosis and the formulation of rational and economic treatment that will minimize morbidity and mortality of affected animals. Undifferentiated bovine respiratory disease complex is characterized clinically by the following. Number 1, dyspnea. Number 2, coughing. Number 3, nasal discharges of different degrees from serous discharge up to purulent discharge. Number 4, varying degree of the. Number 5, anorexia. Number 6, increase in the temperature of the animal or the pyrexia that ranging from 40 to 41 centigrade. Number 7, evidence of pneumonia on auscultation of the lungs, which variable from moist rales to dry rales to whistling sound or harsh rales. Number 8, a variable response to the treatment that ranging between unfavorable conditions of treated animal up to completely recovered animals by the different aspects of drug treatments. Some unexpected deaths may have occurred as initial indication of this problem. Although in most cases pneumonia is the obvious cause of the disease, determining the etiology is the major diagnostic problem, as this type of pneumonia is caused by various types of risk factors, as we speak within a while. Undifferentiated bovine respiratory disease complex is one of the major multifactorial problems that affecting feedlot animals all over the world, which cause a major ill health and economic loss in all domesticated animals. Mortality rate of bovine respiratory disease complex ranged between 44 up to 72 in feedlot cattle, and morbidity rate of bovine respiratory disease complex ranged between 0 up to 19%. Economic impact of respiratory disease on the USA beef industry is estimated to exceed $4 billion annually, including treatment costs, disease prevention, and productive losses from the affected animals. This collective slide clears the effect of bovine respiratory disease complex on the economic cost of European United as €576 billion, and bovine respiratory disease complex cause huge losses of performance between the European United group of countries. Treatment of bovine respiratory disease complex per animal ranged between 48 up to 101 euro and 500 euro if death occur. Bovine respiratory disease complex all over the world is the most common cause of deaths under 1 year old. Bovine respiratory disease complex leads to proportional to reduction in the average daily life weight gain, or what is named by ADLWG. Bovine respiratory disease complex leads to 70% reduction of lung at slaughterhouse, which leads to lower grade of carcasses and lower prices. 30% of cattle have history of bovine respiratory disease with clinical syndromes, and 40% of cattle showed undifferentiated bovine respiratory disease complex, while all over the world 30% of cattle showed no signs at all of bovine respiratory disease complex. Bovine respiratory disease complex phenomena in developing countries noted under two managemental regimes as the following. The first one, calves of 1 up to 8 weeks of age, which weaned from their mothers within few days and fed on milk replacers. These calves facing two different respiratory pictures where one will lead to the other. The first picture is sudden and acute in nature, with variable names, acute pneumonia or enzootic pneumonia. The second picture is chronic or coughing pneumonia. The second regime weaned suckle calves from 6 months of age up to 2 years old. This type usually occurs following to transportation and housing, and known as transient or shipping fever. Different risk factors associated with undifferentiated bovine respiratory disease complex. Different risk factors associated with undifferentiated bovine respiratory disease complex. Number 1, pathogenic risk factor. Number 2, epidemiological risk factor. Number 3, environmental risk factor. And the last one is managemental risk factor. Different aspects about undifferentiated bovine respiratory disease complex. We will speak about different aspects for complete clearing of undifferentiated bovine respiratory disease complex. First aspect is the pathogenesis of different pathogenic risk factor or different pathogens. Number 2, clinical forms of this disease. Number 7, post-mortem findings. Number 8, the diagnosis of this disease. Number 9, treatment and management of this phenomena. And number 10, the control of bovine respiratory disease complex. When we speak about the pathogenic risk factor, we have 5 different pathogenic risk factors. Number 1, viruses, and then the bacteria, as well as fungi, mycoplasma organisms, and parasites. The viruses, we have 8 types of viruses. Number 1, bovine respiratory syncytial virus and reovirus type 1, 2, 3, and 4, parainfluenza type 2 and 3, adenoviruses, rhinoviruses 1, 2, and 3, bovine viral diarrhea, infectious bovine rhinotracheitis, IBR, bovine coronavirus. The bacteria as a pathogenic risk factor, we have 10 names of bacteria: Streptococcus pneumoniae, Actinomyces pyogenes, Haemophilus somnus, Pasteurella or Mannheimia hemolytica, Pasteurella maltosida, Escherichia coli, Fusobacterium microphorum, Staphylococcus species, Klebsiella species, and Eremonas species. The Mycoplasma microorganism, we have 7 types. Number 1, Mycoplasma mycoides, var mycoides, that causing contagious bovine pleuropneumonia, and we will discuss this in detail in following lecture. Mycoplasma tespar, Mycoplasma bovis, Mycoplasma bovirinis, Mycoplasma bovigenitalium, Mycoplasma arginini, and Uriplasma. The fungal organisms, we have 6 types: Aspergillus fumigatus, Aspergillus niger, Aspergillus oryzae, Candida species, Geotrichum candida, and Rhodotella species. The parasites, atypical interstitial pneumonia of Verminus Dictocaulos viviparus, which distributed all over the calf food ages. This collective slide describing the undifferentiated bovine respiratory disease complex form a huge percentage of cattle deaths all over the world. We here write the pathogenic risk factors as well as some other risk factors that leads to this phenomena, as young age, mixing of different species of calf from different areas, the changes in the weather during autumn, winter, spring, and summer, and movement of them between different farms and areas, as well as purchasing from markets by means that purchasing of them from undetectable and eye protected farms. At 59 days, most of deaths will noted between the calves. Undifferentiated bovine respiratory disease is the main killer of the calves. Epidemiological risk factors that cause and help in the occurrence of bovine respiratory disease complex. Bovine respiratory disease complex is commonly reported in calves within 2 to 5 months and reported in young calf with 1 week, as well as the growing animals up to 1 year. Age susceptibility might be related to decline of colostrum immunity within the first 2 months of age, with development of acquired immune system, as colostrum is the most important product that given to the calves within the first 27 up to 28 hours. Later than that, we will notice the closure of the intestinal pores and the colostrum will be without profit. In healthy calf, IgA producing cells constitute a great population of IgG procedures within subepithelial tissue of lung airways. The rate of pneumonic calves will decline when serum IgG2 began to increase by means that by specific or non-specific immunity. Problems of pneumonia in calves commonly noted in veal calves raised in closed system under intensified condition because of the undesirable risk factors increase this phenomena. Environmental risk factor. Environmental factors have an important role in feedlot pneumonia problems. This is due to exposure of different stress factors and microbial agents as the following. Bringing calves from different farms together will tend to increase the rate of the disease due to sharing of new microbial nature, different environmental conditions, new social demands. Inadequate ventilation, improper climatic control, poorly constructed or maintained facilities. Mucociliary rate and alveolar pathogenic activity were decreased due to the bad environmental factors that present in some farms, as well as overcrowding increases exposure to the disease agent. Type of calf housing effect on occurrence of the disease as highest proven respiratory disease complex degrees reported in perforated walls and floors, as well as overcrowding of 25 or more calves in a small barn area. Dry bedding and open-air barns are optimum conditions for prevention of respiratory illness in animals. But even under them, rapidly changing weather, dust and other immune system stressors can take a heavy role in ruminant animals. Low environment temperature and high humidity before the disease reported within 24 up to 72 hours. Cleanliness, air quality, relative humidity, air draft, ambient temperature, and degree of temperature fluctuation usually affect on the disease induction in calves. Respiratory diseases occur throughout the year during two peak levels. The first one between October and December, the second one between February and May, and these peaks reported during the calfhood gathering time all over the year. Managemental risk factors. Management of calves from the first moment of life until sending them to slaughterhouse play an important role in induction of respiratory diseases of absence of them. Feeding calves on adequate quality of high quality colostrum 27 up to 28 hours soon after births have been documented. Weaning time is important as lung lesions in calves weaned at 5 weeks of age were found more than calves on ad libitum substitute diet up to 14 weeks old. Cows rearing near calves in closed door may lead to pneumonia. Inadequate cleaning and disinfection between patches play an important role in persistence of infection in the farms. Mixing of different ages with each other play as stresses on calves for induction of pneumonia. Different breeds show different susceptibility for bovine respiratory disease due to difference in skin thickness, immunity, and the previous exposure to such microbial agent. This classical picture in cattle farms explains perfect setup for respiratory distress, dampness as we see here, and a changing weather exists the right condition for developing of pneumonia in these poor calves. Pathogenesis aspects of bovine respiratory disease complex causative agents. Respiratory viruses have the ability for induction of interstitial pneumonia that affect on the cranial lobes of the lungs. Primary viral infection opens all the ways for secondary invasions by bacterial, mycoplasmal, or fungal infectious agents that commonly aggravate the case. Fungal infectious agents. Multiplication of these organisms occur inside the alveolar tissues resulted in pneumonia, which may be changed into uterine infections, leads to abortion, and the main pathogenic way here is by inhalation. Clinical forms of Bovine respiratory disease complex. Clinical features are similar, even with different infectious agents. All clinical pictures are identical with tendency to rising of temperature. All infected animals show febrile reaction with signs of dullness, depression, anorexia, lethargy, dyspnea, and cough. Auscultation for detection of major abnormalities will be at the ventral aspect of apical and cardiac lung lobes. Signs of acute catarrhal purulent and or chronic bronchopneumonia were detected in all cases of viral pneumonia. Harsh and loud breath are transmitted through consolidated lungs with increased intensity of cardiac sounds. This count showing typical appearance of recently calved Holstein heifer at presentation. All cattle were dull and depressed with poor ruminal fill. Nasal discharge can be one of indicators of pneumonia. Open mouth breathing and neck extension in adult Holstein with retropharyngeal abscessiation and pain associated with enterogenic trauma. This cough showing coughing due to undifferentiated Bovine respiratory disease complex. A cough infected with Mannheimia hemolytica, pneumonia showing anorexia, depression, extended head and neck to minimize upper airways resistance, and ventral edema caused by both albumin loss into the severely infected lungs and gravitational edema. Open mouth breathing in a 5-year-old cattle had respiratory difficulties during only winter months. A cough showing advance of pneumonia. A cattle with chronic suppurative pneumonia typically stood with the neck extended and the head held lowered like wood. This is a picture of a calf suffering from malignant catarrhal fever with purulent nasal discharge. Take honey-like. Post-mortem signs of Bovine respiratory disease complex. In most cases of pneumonia, there are areas of collapse, emphysema of the apical lobe, and less extent in the cardiac lobes with a little involvement of diaphragmatic lobes. Late stages of pneumonia characterized by presence of dark red consolidation with a little or no fluid present in the lungs. Pleural surface usually shown inflammatory reaction. This is a picture of cut section at necropsy through consolidated lung with appearance of purulent nasal discharges. Cut section through major airways revealing large quantities here appear of purulent nasal discharges in lung tissue as well as in the bronchioles. Inhalation or aspiration pneumonia in adult cattle shows several abscesses and dark red consolidated areas within the lung tissue. Necropsy revealing sharply demarcated as here of lung pathology in the ventral portion of the lungs lobes of a cow with chronic suppurative pneumonia that didn't respond to antibiotic therapy. The pathology affects approximately 30% of the right lung in this animal. Here, this is an abscess, and this is dark red consolidated areas, and here is the normal lung, and we can see the line of demarcation. Necropsy revealing the bulk of a cow with a chronic suppurative pneumonia that didn't respond to antibiotic therapy, where several abscesses here as you see. Pneumonic lung with red hepatization at apical lobe. We can see the dark red areas and the normal color of the tissue. Interstitial pneumonia in a lung of a calf 2 weeks after invasion with Bovine respiratory syncytial viruses. Field diagnosis of Bovine respiratory disease complex. Number 1, epidemiological situation of different types of respiratory affections, including the nature of the infection, spreading of the disease, morbidity and mortality rates, which differed according to the pathogenic risk factor. Number 2, the different clinical forms as we explained before, and as well as post-mortem findings as you see in the latter slides. Laboratory diagnosis. Number 1, sample collections. Samples collected from living animals are blood during the feverish condition, serum, nasal and ocular discharge, tracheal lavage, and the nasal swabs. In case of Haemophilus somnus, the specimens have to be protected from dryness, preserved at 60 centigrade, and cultivation should be done within 24 hours. Samples collected from dead animals includes portions from the lung edges, tracheal scrapings, and bronchial wash. In case of septicemic animals infected with Pasteurella maltosida, pieces of liver, spleen, kidney, and lymph nodes should be collected. Direct microscopical examination. Direct microscopical examination, this done on the respiratory exudates and obtained cultures for demonstration of secondary invaders. In case of mycoplasmas, the organisms are stained as gram-negative with different shapes under microscopic shaping as cocci, ringed, spiral, filamentous, granular, and globules. In case of Actinomyces pyogene, this is demonstrated in large number of small, highly pleomorphic gram-positive cocci, gram-positive rods, or beer in shapes, and occasionally take branching short forms. In case of Haemophilus somnus, there are gram-negative coccobacilli that give bipolar reactions in several cases. Pasteurella organisms appear by presence of gram-negative small coccobacilli with bipolar reaction. Mycotic pneumonia characterized by appearance of matted hyphae in case of fungal organisms or ovoid and budding cells in case of yeast infection. Isolation of microbial agents. In case of viruses, we can isolate the different aspects and different pathogens of the virus on the following cell cultures: bovine cell cultures, swine, equine, and rabbit kidney cells, calf alveolar macrophages of the lungs, pig, monkey, and mice fibroblast cell cultures, spleen, trachea, tonsillar cells, and embryonic skin cells. In case of mycoplasmas, mycoplasmas are fastidious organisms. Specific growth of them need certain factors as isolated media and absence of inhibitory substances. We can cultivate them on beef heart infusion, peptone glucose, and yeast extracted vaginal mucus, avian allantoic fluid. The optimum temperature of isolation is 37 centigrade. Incubation time ranged between 3 to 7 days. In case of different species of pathogenic bacteria, we can use oxoblood agar with 5 to 10% of carbon dioxide tension at 37 centigrade for 24 hours, or ox or sheep blood agar for gram-negative bacteria, they giving different hemolytic zones, alpha or beta, and some types of bacteria tolerate by salts on the McConkey agar or broth used for cultivation of gram-negative bacteria. Fungi and yeasts are isolated on Sabarotes dextrose agar with chloramphenicol. The optimum temperature ranged between 25 up to 37 centigrade according to their species. Different colonial morphology according to isolated fungi has been recognized. Immunofluorescent technique is a new technique depend upon the antigen-antibody reaction inside the cell. This is perfect and highly sensitive as well as protect the different laboratory workers and doctors from reinfection by the microorganisms as in cases of tuberculosis. This technique is used for detection of either antigen or antibodies. This technique used for detection of either antigen or antibodies with protection of the workers in the laboratories. ELISA test used for detection of different viral and mycoplasmal antigen and their antibodies. Their sensitivity reached to 90% and their specificity reached to 80%. Complement fixation test is an immunogenic test that used for diagnosis of infection caused by mycoplasmas, Actinomyces pyogene, and Haemophilus somnus. Haemophilus somnus shows positive reaction 10 days post-infection. Passive heme agglutination test. This test used for diagnosis of Pasteurella organisms. Immunoperoxidase test, one of the newest technique that used to showing the antigen or antibody reaction inside the cell itself with sensitivity reached to 95% and specificity reached to 90%. This test used for detection of different pathogenic antigens in unstained tissues section, prepared from infected tissues, as well as detection of some viral antigen in the blood leukocytes. It is a specific, accurate, and very reliable technique for diagnosis. Western blot technique. It is a modern, specific, and accurate test used for detection of different pathogenic agents. Western blot technique used for detection of the different protein bands of the structure of the bacteria, fungi, or the viruses, such as cell wall, nucleus, mitochondria, and different aspects of the cells of the different microorganisms. Polymerase chain reaction PCR and reverse transcriptase polymerase chain reaction RT-PCR is very sensitive test, reach to 100 sensitivity and 100% of specificity. It is a fast detecting test, can get the results within 8 to 12 hours of the beginning of the test. This modern technique of molecular biology used now on a wide scale for specific diagnosis of different infectious microbial organisms. Not else in this disease, but in all infectious diseases, either in animal or human aspects. Histopathological examination. Pasteurella infection resulted in edema, fibrin presence of large number of neutrophils and macrophages inside the alveolar cavities. Mycoplasma reveals hyperplasia of lymphoid tissue, forming coughing pneumonia. In case of parainfluenza 3 infection, cases of intracytoplasmic inclusion bodies in nasal and bronchial epithelial cells were detected. Bovine respiratory syncytial virus causes hyperplasia of alveolar epithelial cells with syncytia formation appear as eosinophilic intracytoplasmic inclusion bodies in the interstitial areas that caused by this virus. Treatment and the management of bovine respiratory disease complex. All the following steps are used safely for several decades for treatment of bovine respiratory disease complex. All antibacterial drugs should be used continuously for 3 to 7 days for short-acting drugs and day by day for long-acting drugs post-application of accurate sensitivity test in the labs. Antibacterial drugs, we have sulfonamides, sulfadimidine, and sulfamethazine as 150 mg per kilogram body weight. Fluorphenicol 20 mg per kilogram body weight. Streptomycin preparations as 10 mg per kilogram body weight. Lincomycin used as 5 mg per kilogram body weight. Oxytetracycline as short or long-acting drugs as 10 mg per kilogram body weight. Amoxicillin as 7 mg per kilogram body weight. Antibacterial drugs. Number 7, tyrosine tartarate as 4 to 10 mg per kilogram body weight. This is specific for mycoplasma organisms. Isoniazides as 5 mg per kilogram body weight, and this is used in case of tuberculous animals. Penicillin as 22,000 international kilogram per kilogram body weight. NSAID, non-steroidal anti-inflammatory drugs. These drugs are salicylate-like compounds which make reduction of inflammation by blocking the synthesis of prostaglandin and kinin. They also antagonize the action of some chemical mediators as 5-hydroxytryptamine, 5-HT, and histamine. They act as antipyretics and analgesics. We have four perfect non-steroidal anti-inflammatory drugs used in veterinary medicine as acetylsalicylic acid, indomethacin, mefenamic acid, ferronoxine maligalate. Corticosteroids. They reduce the inflammatory reactions, vasodilatations, edema and leukocytes infiltration. They used with umbrella of antibiotics have to be. There are 3 types of dexamethasone is short acting. Dexamethasone 2 to 5 mg per kilogram body weight. Beta-methasone 2 to 10 mg per kilogram body weight, and this is used day by day. Flumethasone as 0.5 mg kilogram body weight, and this is long-acting corticosteroids. Antihistaminics. They are used early in the beginning of inflammatory process. That means that in acute cases. Allergenamine as 10 mg per kilogram body weight. Antihistamine 10 mg per kilogram body weight. Avil ampoules as 10 mg per kilogram body weight. Sympathomimetics. They are adrenaline-like that leads to increased blood pressure, to increase passive dilatation of blood vessels to the lungs. This processes resulted in reduction of edema with bronchial relaxation. Sympathomimetics are amphetamine 0.2 up to 0.6 mg per kilogram body weight, isoprenaline 0.8 mg per kilogram body weight, and sabtelamol, which act especially in the bronchial B1 receptors and also as a bronchial dilators. Xanthine derivatives. They simulate adrenaline in the action by stimulate of central nervous system, myocardial action, and bronchial dilator. We have 2 examples. Xanthine, such as aminophylline, is used orally in a dose of 0.15 up to 5 gram per calf or 0.3 up to 1.5 gram per calf when injected subcutaneously. Dibrofenylline used as in case of a dose 0.12 up to 0.5 gram per calf as a bronchial dilator. Expectorants. They make reduction of mucus viscosity with expulsion of mucus secretions. Prohexamine hydrochloride as 0.5 mg per kilogram body weight. Strychnine hydroxide, arsenic trioxide or all the arsenical preparations, ferric ammonium citrate green as 5 ml twice daily for a week. Antimycotic drugs. When direct microscopical examination and sensitivity test in the labs said that the causative pathogenic agent is a fungi, we can use nystatin, amphotericin B, grisevolvin, clotrimazole, or micoconazole. All of them act as broad-spectrum antifungal drugs. Supportive treatment. They are used to come over the adverse reaction of the disease with supplementation to minerals, vitamins that help in repairing of epithelial lining of respiratory tract as vitamin A-D3E and vitamin B groups. Good nursing. Good buildings with avoidance of air drafts prevent the different stresses on the calf health. Nursing of affected calves will help their rapid recovery by isolation of infected animals, offering of plenty amount of water, palatable and easily digested food. New approaches in the treatment. Natural human interferon alpha or NHULFN alpha is used in the treatment of bovine respiratory disease complex in calves with complete success. In case of mycoplasma infection, using of recombinant bovine interferon gamma resulted in reduction of pneumonic lung volume and severity of pneumonia. Control of bovine respiratory disease complex. Number 1, application of good management of calves. Number 2, prevention of overcrowding, where each pair contains not more than 30 calves and each group should have the same ages. Number 3, newly purchased calves should be isolated for several weeks before joining to the other after application of the less vaccines that taken in the new area. Number 4, offering of balanced calf starter grain ration supplemented with essential vitamins and minerals, as well as good quality of hay with the beginning of the third week of age. Number 5, urgent treatment for diseased calf to avoid spreading of the infection. This done after isolation. Number 6, vaccination of calves during susceptible time with available vaccines as the following. Number 1, inactivated polyvalent vaccine for parainfluenza 3, bovine adenovirus type 3, bovine reovirus type 1, bovine viral diarrhea, and IBR. Vaccines were given intramuscular with 3 doses with 2 weeks apart, beginning from 1 month of ages. Vaccination against bovine viral diarrhea by using of inactivated virus vaccines or attenuated virus vaccine. Inactivated and modified live virus vaccine against IBR. Vaccination against mycoplasma with intramuscular inoculation and intratracheal infusion with killed organisms. Haemophilus somnus infection could be controlled through vaccination by killed bacterium vaccine. 2 injections subcutaneously with 2 to 3 weeks are enough. Pasteurella vaccines in the following slides. Number 1, plain broth bacterines, alum precipitated and ammonium hydroxide gel vaccines are administered twice a year since they offer immunity for 4 to 6 months. Oil adjuvant vaccine that give both higher degrees as longer duration of immunity reach up to 1. Thank you for your attention. Please subscribe to this channel to reach to the most accurate, newest knowledge about veterinary diseases for large and small animals. See you later.